I'm Ashton Addison from EventChain for Investmentpitch Media and FinTech News Network. And today on Blockchain Interviews, we have Chrissa McFarlane, the founder and CEO of Patientory. Chrissa, welcome to the show. It's a pleasure to have you here today.
Thank you for having me, Ashton.
You're very welcome. I love if we can kick off the show by having yourself give some background on how you got into the medtech space and how you integrated that with blockchain to start Patientory.
Yeah, absolutely. So, my background is in health IT. Started out in health IT consultant, did a lot of the early EMR implementations and the mid-tier health systems. Then went on to help, manage and build a telemedicine company, which telemedicine, is not truly effective unless we have access to patient data, which is one of our biggest problems today, to really provide efficient healthcare delivery. So, decided to merge the two, pretty an early adopter of the blockchain and crypto industry. And it made sense from a security standpoint for it to, merge with the health industry as well.
Definitely. So Patientory, it involves medical personal information, and it also involves blockchain. If you could give a high-level overview of what is Patientory, what are the goals, and what are the solutions that you're providing in the industry?
Yeah, well, just to clarify, Patientory is as a health IT population health management software that actually runs on the PTOYMatrix Blockchain network. So that's the underlying technology or blockchain infrastructure that our healthcare software uses to access data. We're focused on population health management in the form of, really utilizing algorithms and AI to predict high-risk patient populations and how to really with these analytics, how to take proactive measures for health systems and employer organizations and larger organizations, for a matter of fact, in providing quality health services.
Great. And what are the main problems that you see in the health industry right now that you're targeting?
Yeah, when we first started the company, we were really looking at targeting the rise in epidemic, especially in the US. So at the time, the company back in 2016, over 40% of American adults had one or more chronic illnesses. And the fact that we don't have an actual infrastructure in place to be able to manage this was the opportunity we saw in utilizing blockchain to provide that data interoperability that does not exist today, especially as we continue to digitize medicine and start to digitize data.
And you mentioned that you worked in health data and you worked with EMRs, which are electronic medical records. Can you talk about how Patientory maybe is similar to EMRs and how is it different?
Yeah, so our software and the PTOYMatrix blockchain is not an electronic medical record. I would say think of it as a bridge that would connect electronic medical records to talk to each other. So typically an electronic medical record system deals with practice management. They're large legacy infrastructures that ingest anything from results and, helping physicians actually schedule appointments for patients. I would say our system would be more considered a host for all of this information that is produced by an electronic medical record.
Okay. And you said that Patientory started fairly early on in terms of the growth of the blockchain industry. Could you talk about when you started, how it's been growing, and what does the status of the application look like today?
Yeah, so the company was started in 2015. We created our white paper in late 2016 and, conducted an ICO through our foundation, which currently governs the overall PTOYMatrix blockchain, HIPAA-compliant blockchain network. To date, we have over 900 storage node host subscribers who act as nodes to support the PTOYMatrix blockchain. And to date, we have over 45,000 subscribers that are on our wait list. for the actual application that's built on this blockchain.
Very interesting.
In healthcare, back in 2019, we started to see more of the larger health systems start to build up, their healthcare practices and start to pilot the technology.
And this is something that more so is complementary to existing health systems rather than disrupting and a competitor to them, would you say?
Oh, yeah, of course. We're definitely not disrupting, or competing with any of the health systems. But it's there to complement them, their delivery, cut costs, and make, just healthcare outcomes more efficient.
I'm curious about the blockchain part with the PTOYMatrix Blockchain. Having your own blockchain infrastructure can have its advantages, but as well disadvantages. Did you, from the beginning, see the need to create something that was an entity on its own as opposed to utilizing a more popular blockchain like Ethereum or another smart contract platform?
So the blockchain is built on, it's actually a private permission fork of Ethereum. So, the token we issued is actually issued on the Ethereum mainnet. And then the actual network that connects, a lot of these secure HIPAA compliant healthcare databases is actually, built off of Ethereum code.
Okay. That's really interesting. And because medical data and personal medical information is obviously prone to a lot of privacy laws, and making sure that people's information is secure, is Patientory taking extra precautions to follow, protecting people's personal information that use the application?
Yeah, so we have a standard here in the States, which I think it's the most highly regulated standard in secure and healthcare data, which is HIPAA. It's the Health Insurance and Portability and Accountability Act, which is put in place actually by our federal government to secure and ensure the security of private health information, which the platform is compliant with. And then we're also GDPR compliant. We've built the platform, which is why it's modified and it's private, with a lot of cryptography and encryption mechanisms to make this data safe as possible.
Great. And you mentioned that there's 45,000 or so subscribers that are waiting for further developments. Can you talk about what's in the roadmap for Patientory in terms of the application coming out and the next steps for the growth of the company?
Yeah, I would say starting with the platform, we have about 4 companies that are actively building on the PTOYMatrix blockchain right now. So different use case applications in the health industry. We are looking to scale that up and, have more companies in the healthcare industry who are building applications integrate with the platform. In terms of our company delivering the software, we provide both an enterprise solution and a consumer solution, which can work in tandem with the enterprise solution. And our goal is to, have that direct to consumer product in the market, fully functioning for users, and then, to continue rolling out our pilots and trials with these large enterprises.
Great. And as the application is built out and into the market, what are the specific revenue models that you're looking to create a sustainable, incoming cash flows through Patientory?
Yeah, just to support the matrix, the network itself, it's funded through the members and companies that are actually building on that. So if you remember back in 2016, you had, the Union Square Ventures and the FAT Protocol paper that was released, and we really see value, really playing a part by the activity that happens on the network. And then, the software that we sell to healthcare organizations and to consumers, it's a SaaS model. So it's software as a service. They're paying annual licensing fee to use the technology.
Great. And you're also integrating a cryptocurrency directly into the platform as well, the PTOY cryptocurrency. Can you talk a little bit about that integration, and how does it work, and how does it provide extra value for the users?
Yeah, so in line with the overall FAT protocol that I described, the token provides the utility. So as we see more usage of the platform and more data stored, the tokens is able to really provide the smart contracts, automation, but also in terms of transferring data and just hosting storage data, it plays utility in that as well.
Okay. And right now, is Patientory looking for more partnerships, investors, node operators, customers? What are your exact goals for growth?
Yeah, absolutely. I know our biggest priorities right now are, more node hosts, of course, people join in the network and the association and provided storage space to the network. Our D application, so the Patientory Inc. D app, we're currently raising our seed round at the moment. So, looking for strategic and early stage investors who are committed to, transforming the healthcare industry and working on, really complex and difficult solutions to problems in healthcare.
Mm-hmm. Great. And if node operators or investors are looking to find out more information about Patientory, get involved with the community and reach out to you, what's the best way for them to learn more?
Yeah, absolutely. I always say, start with our website. You can learn more about the network and the PTOYMatrix blockchain and what we're doing at patientoryassociation.org, and then you can learn more and follow up with, our usage as a D application on top of this healthcare protocol at patientory.com.
Great. Well, thank you so much for your time, Chrissa. I will leave those links in the description box below for the viewers. That's all the time that we have for the interview, but I really appreciate you coming on to speak about Patientory. All the best moving forward with the application, and let's follow up in the near future.
Thank you, Ashton. Great. Thanks for having me.